The following podcast is taken from a live broadcast on Inspire FM.
Any health advice given, whether general, diet, physical or spiritual, is general only and must be verified by your doctor. If you need medical advice, please consult a doctor.
Assalamu alaikum and welcome to all our listeners and viewers. I welcome you all to another exciting and educating edition of the Health and Fitness Show. I'm your host Fahad Matin for today's show, and I hope and pray that all of us are fit and healthy by the grace of Almighty Allah. I do pray that this program is broadcasting live from the studios of Inspire FM today on 6th of February 2020 and casting its positive vibes to all our lovely people in Luton and all people surrounding Luton, like Dunstable, Harpenden, Bedford, and covering all across Bedford. Our positive airway is going through our online sections as well, which is if you know, we have a live Inspire FM app. You can listen us on Inspire FM app. You can listen to us through Inspire FM website, as well as you can view us live on Facebook Live. Yes, indeed. We have a Facebook Live. So all you have to do is just go to Facebook page of yours and then go to Inspire FM Facebook page and click the live link. As we all know, we cover different health and related topic every single week. So today's topic is somewhere on that line, but with slightly different. So today's show, I will be starting my show with a positive quote from John Maxwell, and it goes something like this. Conflict is like cancer. Early detection increases the possibilities of healthy outcome. Yes, indeed. Always, early detection increases the possibility of healthy outcome. So, without further ado, the topic for today is early detection of cancer. Yes, you have heard me correctly. We are talking about early detection of cancer. And I know this is a very touchy subject. It always touched my heart because I lost my mom, unfortunately, through cancer. And day before yesterday, it was World Cancer Day. Yes, indeed. It was World Cancer Day on 4th of February 2020. And definitely on these kind of days, if you have been touched, either you are a survivor or you are a person going through some kind of cancer therapy or cancer detection, or you're a family member, you are always, we all have a special connection on that night. But then definitely, we also have a very limited knowledge about this disease. So as we all know, our show is all about spreading knowledge and information regarding these kind of things. So on this note, let me welcome my guest who is joining us today in the studios. And she is Bedfordshire CCG, which is Clinical Commissioning Group, Macmillan's lead GP, and also an associate GP at Lower Staunton Surgery. She is none other than Dr Saheli Chaudhury.
Hi.
Hello, how are you?
I'm very well, thank you. How are you?
Alhamdulillah. It's and welcome back again. It's your second time.
Thank you.
And today you are not nervous. I can see that. You are very smiley and you are happy, and that's how I like my guests to be. Welcome to our show again.
Thank you so much for having us.
So people who are listening you for the very first time, if you can give us a quick introduction about yourself. I know I have said something, but then it's nothing what compared to you can tell us about yourself.
So I have been a doctor now for 16 years, I think 17 years this year actually. I've been a GP now for 12 years. Mm-hmm. My first hospital job was in haematology and oncology, so I've always had an interest in cancer care. Mm-hmm. So that's what led me to become a Macmillan GP, to try and spread the word and to help strategic pathways and to improve cancer services in our area. So I believe that you want to speak this evening about screening.
Indeed. And as when we talk about early detection, we always talk about screening, and that's something which we all lack of, especially in our areas, where people sometimes feel very different when they've been diagnosed, or when a GP says, look, we have some doubts, why don't you go and get yourself tested? And that's where the situation comes through in a very awkward way, isn't it?
Okay, so but the NHS has 3 major screening programs, and cancer screening is meant for healthy people with no symptoms at all. So if you do have symptoms, please go and see your GP. Screening looks for early signs that could mean cancer is developing. It can help spot cancers at an early stage, so which you said, obviously, if you find it early, you can tackle it better. So when treatment that is more likely to be successful, the chances of survival are increased. So in some cases, it can even prevent cancers from developing at all by picking up early changes that can be treated and stop them from turning into cancer. And that's mainly how the cervical screening programme prevents cervical cancer. Obviously, screening is not perfect and it has harms as well as benefits. So you have to try and inform yourself beforehand so that you're making the right choice for yourself. The main screening programmes that are available in the UK are the breast screening programme, cervical screening programme that I've mentioned, and the bowel screening programme.
So when we talk about cancer, let me introduce our listeners. Sorry, I completely forgot to involve our listeners. So listeners, if you have any questions or queries regarding our topic tonight, which is early detection of cancer or screening of cancer, please give us a call on 01582 481822, or you can send your questions or comments via text messages or WhatsApp on 0779 481822. Or if you are shy, you can always leave a message on our Facebook page. So all you have to do is just go to any of those things, like call us on 1582 481822, or send a message through our WhatsApp or text message, which is 0779 481822, or you can leave a message through our Facebook page and share your comment if you've been somehow either involved in cancer care or been affected with cancer, or one of your family members been affected, or whatever your experience, as much as it can be. Please do share with us. Let us know how it is and how it has touched your life. So Saheli, sorry, that was me bit kind of going off the track in many different ways, because when I sometimes connect with the listeners, I just literally go completely outside the track. So when we're talking about the cancer, when we talk about the prevention of cancer, can we prevent cancer?
Things that you can do to stay healthy, and hopefully that would prevent cancer. So having a healthy lifestyle, eating well, not smoking if you can, stop smoking, and there's a big smoking cessation support groups and projects out there, which is all available. For the information's on the NHS website. These are the things that can help you to tackle the major risk factors for cancer. So trying to cut down on your alcohol intake, and if you can, avoiding alcohol altogether. Managing your weight, trying to lose weight, maintaining a healthy weight, and then eating lots of fresh fruit and vegetables and having a good diet. And then also being aware of your skin exposure to the sun, so that if you do go out and sunbathe, then you please, like, what the Australians say, slip, slap, slop, put on lots of sun factor to protect your skin, because that's increasingly common nowadays, are more skin cancers.
So is it easy to work our way when we do all those care?
So that should help to keep your body healthy. Your body needs maintenance, like you'd look after your car and have a MOT and service it and check it and fill it with petrol. You need to do the same things for your body. I think lots of us take ourselves for granted. So obviously encompassing a healthy lifestyle, exercise, the right diet. If you know that your risk factor for your family is higher, then you need to go and talk to a professional about it, to your GP, and then discuss the risks, and maybe then you may need some tests to be investigated if you have a higher risk in your family. So you need to take that into consideration as well.
Wow. Okay. So when we talk about people, and this is something everybody wants to know, because some people, as I said, they themselves touched the topic by one of the family relatives. Some of them, because of their unhealthy lifestyle, they have doubts. Some people just listen on the radio or TV or any talk show about cancer, and they normally think about what are the common signs and symptoms. Do I have anything? So do you think there are any key common symptoms people should be aware of?
So yes, naturally, if you're feeling lethargic or coughing up blood, noticing blood in your urine, noticing blood in your poo, these are the signs that I would say need more investigation. Unexplained weight loss or feeling generally unwell, lumps or bumps that are new or rapidly growing, changes in skin lesions that you think, oh, this is not right. Just need checking out by a professional and just see whether it needs more investigation or we can put your mind at rest.
So, is there, like, for example, rapid weight loss? Now, some people say that rapid weight loss will be a causing factor. Is that true?
It's not a causing factor. Can be a sign of that.
Sorry, I mean sign and symptoms.
Yeah. So that's true. That is true. So it is obviously some people are on diets and want to lose weight. So if there's a reason for you to lose
like
weight,
myself, I'm trying my level best to lose weight.
Good, well done, Fahad. That's good.
It's not that easy. it's really not that easy at all. But yeah, it's sometimes very odd. Because, but why weight loss is a sign?
So cancer needs fuel, so it needs energy. So it's usually burning off the fat cells in your body because it's using the fuel. So yes, that's why the cancer utilises the fat stores in our body.
Right. Okay. So when we talk about people. Especially when we talk about the cancer screening itself, okay? So I know you touched in the beginning regarding the cancer screening. So why is it going to any of the cancer screening is important?
So there are national programmes in the country. You can go to the NHS website or Cancer Research UK or Macmillan websites for more information about these. So the main cancer screening programmes are breast screening, which is offered to all women aged 50 to 70 in the UK. In England, there is a trial in some areas to see this might be lowered or increased. Cervical screening is offered to women aged 25 to 64 in the UK. It's offered every 3 years for women aged 25 to 49 and every 5 years for women aged 50 to 64. And then bowel screening is offered to men and women aged 60 to 74 in England, Wales and Northern Ireland. And in Scotland, men and women aged 50 to 74 are offered screening. So in some areas also there's bowel scope colonoscopy can be offered to people aged 55.
Okay. So mammogram is something which has been offered to women for breast cancer detection. You mentioned about the age, which is up till 74. Why not afterwards?
I don't know. It'll be the evidence base. It's from the NICE guidance and the national guideline, which is called NG12. So the NICE will, which is the National Institute of Clinical Excellence, will have looked at the evidence base to see whether that age group needs to be checked. But obviously, if you find a lump yourself, and you should be checking your breasts on a regular basis so that you know how it feels for yourself, and if you notice any new changes, especially if you've used the oral contraceptive pill for a long time, because that can be a risk factor for breast cancer, then it's worth being checked over.
So that does not stop someone, because the reason I'm asking is that I was in a patient group. I was there as a guest in one of the patient groups. So one of the patient who have crossed that age, she was saying that we cannot get mammogram now anymore. And I said, well, yes, not as a normal screening, but if you have any doubts, or if you have any,
if you had any symptoms, if you developed a new breast lump, of course you can go to the GP and be checked and sent to the breast clinic to be checked over. So it's not that it's just the routine screening for mammograms on a regular basis stops at that age.
So that takes me to my next question, which is, if somebody is a bit kind of concerned that do I have a cancer? So what are the reasons that person should be concerned that they might have a cancer? And secondly, if they think they have a cancer, what are the steps they can take?
So obviously, if you are concerned for yourself, it depends on what symptoms are presenting. Say if you'd noticed you were peeing blood in your urine, I think that's very important not to ignore that and go to the GP and get checked. More often than not, it's usually a urinary tract infection and just can be cured with simple antibiotics. But if that was persisting and ongoing, then that needs some further investigation. As to with blood in your stool, if that sometimes can just be piles or hemorrhoids, and that can be very common as well, or just blood on wiping. But if that was persisting and you had abdominal change in bowel habits, where to go to a looser stool and more mucus, if you were losing weight with it, then I would say to go to your GP and ask them to check you over.
Okay, so I completely forgot to come back to the listeners. If you have any questions or queries regarding our topic tonight, which is early detection of cancer, please give us a call on 01582 481822. We have Dr. Saheli Chaudhury with us in the studio. She's a Macmillan GB lead who is sharing her wise knowledge with us. So if you have any concerns, if you have any questions or any observations or any comments you'd like to make, please give us a call, or you can send text messages or WhatsApp if you're shy like myself. Or you can also the numbers to send text message is 0794 no, that's my personal number. Completely wrong number giving. 07779 481822. I repeat, 07779 481822. Or you can send text message. You can send messages through our Facebook page as well, just by going onto your Facebook Inspire FM Facebook page and click the live link, and then just send us a message if you have to, or if you like to. So, Sunita, I know Saheli. I don't know why I'm calling you.
That's
Sunita.
Dr. Chakrabarti.
Yes, yeah. Dr. Chakrabarti.
Lovely lady.
Exactly.
Lovely.
Yeah, she's my guest for next week.
Very good. Very good.
That's why she's
very
in my mind.
Good.
Right. So, Saheli, when we talk about cancer, okay, and when we talk about early detection of cancer, I know the difference between cancer. There are people who are concerned and says, I don't think so, I have cancer, but they when the blood test comes in, it shows the sign. So being a GP, it's really hard to have that discussion. How easy it is?
Okay, so it's never easy giving somebody bad news if you suspect that, but majority of the time we have a process in England where we're very lucky in the UK to have a 2-week rule cancer referral pathway, but the majority of those don't tend to turn out to be cancer. Only 8% convert to a cancer diagnosis. So we're using that pathway to exclude cancer. And it's very important that if you do have those symptoms and the GP does the workup and is checking you, and you have some signs or symptoms and you have so if you had a low hemoglobin and a low iron, for example, that could be an indication for a bowel cancer. So then we've got an amazing system for the NHS, which is not surpassed anywhere else in the world. I have friends who work in Australia, and they say to me, we miss the 2-week rule pathway. So I think we're very lucky here to be able to go into secondary care services, which are very efficient and slick, to handle these sorts of issues, and it can be dealt with quickly.
Mm-hmm. So in 2-week rules, what happened? What if I ask from the patient perspective, as a patient journey, what does happen?
So depending on which area of the body and which system you go to.
Okay, let's pick one, the easiest one. Let's pick, let's say, a person coming with pain in the neck side, and anything which you think that it will be a nice way.
Okay, so
I'm so sorry, I'm putting you on the spotlight.
Okay, so breast cancer. So if it was a lump that you'd found, you would go to a one-stop clinic usually, and they would undertake usually a fine needle aspirate and an ultrasound scan and possibly a mammogram. And usually that's all dealt with very quickly, all in one day. So that's very, very efficient service to try and reassure you. Because the body is so complicated, there are different pathways for different parts of the body. Obviously, if you had an abnormal chest X-ray and you're a smoker, although we don't have a national lung cancer screening programme yet, I do believe that Luton is one of the first trial areas in the country to be having that tested soon. I think there's going to be a lung health check in the area. So that's good, and that goes to respiratory physicians, and they would work you up and possibly do a more detailed investigation, like a CT chest, and determine what to do from there. But obviously, if you had a problem with breathlessness or persistent cough, coughing up blood, that they're the symptoms for lung cancer. But obviously, if you had, say, issues with irregular bleeding as a lady, vaginal bleeding, those can be issues for gynecological cancers.
So there are how many cancer types are there?
Oh, it's like over 200.
Ooh, ouch. Okay, that's no wonder it's really hard to.
You can't. It's hard to break it down.
Quantify them.
Yeah.
Okay, the cancer screening program which we have, you mentioned we have breast cancer, we have
bowel,
cervical, and
breast screening, cervical screening, and bowel screening are the three nationally rolled out. And they're just trialling a lung health check at the moment.
Okay, so if we pick like the easiest one, which is cervical screening, which not the easiest one, but hey ho. So that screening starts from the age
of 25 now in the UK. And it's offered to women every 3 years till the age of 49, and then every 5 years between the ages of 50 to 64. Obviously, with the introduction of the HPV vaccine, we're hoping to radically decrease the number of people in the country now to develop cervical cancer. So if you're invited to your cervical screening test at your GP, and yes, I can appreciate it can be embarrassing, but the nursing staff and the doctors, they're trained, it's professional, they'd make it as easy and as comfortable for you as possible. They try to allay your fears and anxieties, because some people get upset having their smear done, which is natural if you're anxious about that. But I think it's one of the best things as a woman that you can do for your own health. So going forward every 3 years, it's just worth 5 minutes. And if that 5 minutes helps to, we can stop cancer developing. So if we notice any changes, that can be easily treated. So it's not, I've definitely got cancer with cervical screening. It's more of a journey. It's more changes, like gradual changes. So if you have regular screening, then it's more easy to be picked up earlier, and then we can do something about it.
So once you have that screen once a year, and then it will
3 years, every 3 years.
Every 3 years you need to get. Okay, so one of the other controversial question which people normally think about when they come to things like cervical screening is that if they are unmarried or not sexually active at all whatsoever, they reckon, why do we need something like that?
Okay,
especially unmarried and have not had any
So the HPV virus that causes cervical cancer can be transmitted just through hand contact. And even though if you haven't had full penetrative sex, you can still have the HPV virus and carry that. So there are many strains, and the HPV vaccine that has been introduced into the country goes for the main common strains to prevent them. But there has been some evidence that even nuns have developed cervical cancer. It's very rare, but there is documentation. So I would encourage people to have their cervical screening on a regular basis.
Okay. Thank you so much, Saheli. That's almost, we have run out of time for the first hour. We're going for a very short commercial break. When we come back from break, we will definitely like to find out what are the certain age costs are very prone to age cancer, and what kind of cancers are in those particular people prone for, and definitely want to know what are the current screening programs offer for what age in slightly more detail for the other ones which we have, like we just touched on. But all this after the very short break. Stay tuned.
You're listening to an Inspire FM podcast, making available our popular programs from our daily broadcast on Inspire FM.
Assalamu alaikum and welcome back to the Health and Fitness Show. I'm your host Fahad Matin for today's evening, and we are talking about early detection of cancer with my lovely guest, Dr. Saheli Chaudhury. This program is broadcasting live from the studios of Inspire FM today on 6th of February 2020. And it's positive and reaching its lovely people in Luton and the surrounding areas of Luton, like Dunstable, Harpen, and Bedford, and reaching to our online listeners as well from Inspire FM web app or mobile app or web page. Also, you can view us on our Facebook live page. All you have to do is just go to Inspire FM Facebook page and click the live link. Today, as I said earlier, we are talking about early detection of cancer with our guest, Dr. Saheli Chaudhury. And before we went on break, we were talking about cervical cancer and what are the taboos attached to it. Saheli, as I have asked before we went on break regarding cervical cancer, but then I know, being a GP, and being a female GP, when a females come to you, do they have any concerns?
So it depends. Sometimes people have symptoms if they're bleeding after intercourse. So that can be a red flag for cervical cancer. So that's very important if that's happening a lot to you, recurringly, that you have swabs done and infection is ruled out. And then if that's still the case, then that needs to be referred on. Also, erratic in bleeding in between your periods, we call that intermenstrual bleeding, that needs to be investigated also. And if you're over 45 and you're having very erratic, odd, heavy bleeding, that also needs to be investigated. So they're the things I'm looking for when patients come to me. And we can do scans. We can do an ultrasound scan of the uterus, the womb area, very easily, to just like to check the thickness of the lining of the womb, or if there's any fibroids there or anything that needs further investigation.
So, in terms of fertility terms, can they conceive?
It depends what's found.
Okay.
So for cervical cancer, usually we don't even get to the stage of the actual cancer. There's stages. So there's like mild, moderate, and changes. So they're like precancerous, which can be treated completely and completely cured. So if depending on where you are in that sort of pathway, it will happen what will happen going forward.
Okay. Now the second controversial issue regarding the cancer, when we talk about breast screening cancer.
Yeah.
Now, breast screening cancer, there was a time when it says that more women dies from breast screening cancer than any other cancer. But then that was ruled out, saying no, that's not the true case, because more survival rates are now with breast screening cancer. Is that true?
I think breast screening has helped to prevent more breast cancers, and we have great programming in our area. Like if you do exhibit any breast symptoms that you're concerned about, that it can be easily referred on to a clinic. Breast cancer screening uses a test called mammography, which involves taking X-rays of the breast, and that helps to find the breast cancers early, or when they're too small to be seen or to be felt. So the small, tiny breast cancers are usually easier to treat than the larger ones. So the breast cancer screening program finds cancer in about 8 out of every 1,000 women having screening. So it's still only a very small number being found positively, but can be life-saving.
And some of the stats, which I'm just literally going through in front of me, it says that 2.59 million women aged between 50 and 70 were invited for breast screening in England during 2016-17.
Yeah.
And the same ratios are going up and up, in 2.48 million in 15-16, and so forth. And is it that screening help? Is that kind of a screening help people?
Yes, definitely. So if you are younger than 50, your breast cancer risk is very low. Mammograms are more difficult to read in young women. However, saying that, young people can get breast cancer. So if you do feel a lump, or you had nipple discharge on one side, or if you had bloody nipple discharge, or you're having tethering or skin changes to your breast that you think are unusual and persisting, or if you notice any lumps underneath your armpit which are unexplained, or any lumps in your breast that you're thinking that this is new, this is odd, please go and see your GP to be checked out.
And is the examination easy?
Yes, it is. There are videos available to learn how to self-examine, and it's mainly with the pulps of your finger in a clockwise motion, just checking the 4 quarters of the breast, and then the nipple area, and then going up into your armpit to feel the tail of the breast and your actual armpit. So we're looking for any lumps in those regions. And if you check your breasts on a regular basis, maybe mid-cycle, every month, then that lets you know how your breasts feel. Breasts are, inevitably lumpy because they're made of like fatty tissue. So it's worth just noting if you find anything hard, craggy pea-sized little lump. If that's something new, then that needs to be checked.
Okay, so I'm just literally looking at the Cancer Research UK website, and it says that in the 2014 to 16, there were 55,213 cases, out of which only 11,000 have passed away. But the survival rate of people in England, which is 78% survival rate. So survival breast cancer for 10 or more years in female only between 2010 and 11 till England.
So breast cancers found by screening are generally at an earlier stage. So very early breast cancers are usually easier to treat and may need less treatment and are more likely to be cured. So the current evidence suggests that breast screening reduces the number of deaths from breast cancer by about 1,300 a year in the UK. And almost all women diagnosed with breast cancer at the earliest possible stage survive for at least 5 years after diagnosis and are likely to be cured.
Wow. Okay. That's a really good story in many different ways.
So obviously breast screening is not perfect. Nothing is perfect, but it's there to help people.
Okay. So in terms of people, as I have asked earlier, so 75 and above, age 75? Yes. So people who are age 75 and above, if they want to check, they can still go to...
Yeah, they can. They have to go to their GP to be referred. But obviously, if you found any symptoms that were worrying, then yes, you need to go in earlier and ask for help.
Okay, and again, a very awkward question. So, if a female patient, went to a GP and that's a male GP, can they ask a chaperone to be there?
Of course, they can ask for a chaperone. Of course, and then they can.
So, people who do not know what chaperone is.
So that's usually another member of staff who is trained to offer support for the patient and to act as an advocate for the patient, and who also is there to support the doctor to make you feel comfortable with an examination procedure. So male doctors are trained just as well as female doctors. We always go through rigorous training, and we want to do the best for our patients. So if you felt uncomfortable having a male doctor to examine you, you can always rebook and ask to be seen by a female doctor if that is possible in a practice.
Or a nurse as well?
Yes, I think there are nurse practitioners who are able to do that as well.
Okay, cool. Because sometimes it is some female, unfortunately in Luton, they do feel, and that's one of the reasons they prefer. Yeah, exactly.
Okay.
But anyhow, that's. But when we talk about breast cancer, I know one of my guests in past, she has survived breast cancer. She's a breast cancer survivor for 20 plus years, and she's one of the best of cases. And we do. I was surprised. I'm sorry. I was supposed to call her today and completely forgot to invite her today. It was my mistake. But yeah. So the cases of survival. But then there are relapses as well. So people who had gone to cancer, they do have relapse as well.
So more and more in the UK, people are surviving cancer. So they're saying that the population who will survive cancer will outstrip the number of people who have diabetes in the country. So going forward, because our treatment is so amazing and medicine has made such amazing advances, we're going to see more cancer survivorship, which is only a good thing. But obviously, as humans, we all die eventually. Nobody escapes that, sadly. But that's a fact of life. It's a hard fact to swallow, but it is a fact. So I feel that, yes, cancers can relapse and reoccur. So it's being aware of your own body. And if you notice any changes that you're worried about, then to seek help.
Okay. Let's talk about the third screening program, which is the bowel screening program. Okay. So in terms of bowel screening program, what sort of a screening program it is? What sort of...
So the screening program for England sends a bowel cancer test kit every 2 years via the post. So you have to actively engage in that and do that yourself. And it's now called a fit test. It's really easy to use. It's like a little swab you put into your poo, and then you send it off into the post, and we can detect very well if you are at risk of having a bowel cancer. And if you are, then you're given the opportunity to be called in to have a colonoscopy. So I think it's very important to engage with that. Lots of people have their tests sent to them in the post and then they don't do them. So it's very important. If you have got the opportunity, it's very easily to be done. I know some people are frightened to do it and they don't want to talk about poo and they don't want to touch the poo, but it's just a few minutes.
Let's talk shit about it.
So honestly, we're very lucky to have that facility in this country. It's free. So I think that's amazing. I think that if you were worried about it or you want to talk about it with your GP or get more information, like I mentioned before, the NHS website has a lot of information about FIT and bowel screening programme, as does the Macmillan website, as does Cancer Research UK.
Okay. And in terms of the cancer itself, is cancer prone to certain race, caste and people? And is there any specific cancer which are certain to which affect any certain race or caste?
So that depends genetically. So yes, I think that's too broad a question for me to answer properly. I'd say yes, there are certain cancers. So I feel Afro-Caribbean gentlemen have a higher risk of prostate cancer. I think that's really important to know. Obviously, if you're fair and you're prone to sunburn, that Irish people who burn easily with red hair, blue eyes, they're more likely to get skin cancer. That's just off the top of my head. I can work on that one. Maybe next time you invite me again, I'll look into that more and give you a better answer than
Definitely. No, it is quite true because, and also I heard that some people, when you talk about genetics, so it suggested that if you have a genetic, if you have anybody in your family who had cancer, that you're more likely to have cancer. Is that true, or is it just a myth?
No, that's not a myth. So I think if there is a strong family history of cancers, we have an amazing national genetic screening sort of program that we can be referred into with your full family history, and then they can discuss the risks with you going forward and whether you want to be investigated further for those risks.
So with those, when we talk about risks, what sort of risk we talk about?
So it would just depend on that family. So if there was a family history of BRCA,
sorry, when I said please give an example. I mean,
so if it was the BRCA positive gene, the mother was affected, and the grandmother was affected, or the maternal aunt was affected, and then the daughter of the mother wanted to know her risk, so she could inquire into that and see how high her risk of developing a breast cancer is, and whether she would want to take preventative measures, which can be sometimes quite drastic, but that's to prevent cancer. So they may be offered a mastectomy to prevent the cancer in the first place. But that's a complicated scenario. It's very rare, but we do have an amazing system that enables us to do such specialised and look at the risk benefit ratios.
Okay, let's involve our listeners as well. Listeners, if you have any questions or queries regarding our topic tonight, please give us a call on 01582 481822. I repeat, 01582 481822. Or you can send your questions via text message or WhatsApp on 07779 481822. I repeat, 07779 481822. Now, I have a question on the screen, and it goes something like that. Does women who do not breastfeed get breast cancer? That's a bit odd. Okay. It's one of the myths. Exactly. Yes. Bit kind of odd. Yeah.
I can check that.
Yeah, well,
I don't know. I don't think so.
I have another question coming in. It says, can you ask about a PSA test? What a PSA test?
So that's the prostate-specific antigen test.
Okay.
There isn't a national screening programme for prostate cancer currently. But if you were just exhibiting symptoms of having changes in your urinary stream for the force of the stream, or if it's splaying, or if you have dribbling at the end, or if you're going more often for a wee without any burning sensation, no water infection has been identified, then we need to check for prostate cancer.
So, is the prostate cancer screening test and the bowel screening test are same, or they're different? Sorry, I'm asking.
No, sweetie, no. So they're completely different screening. There is no national screening program for prostate cancer yet.
Okay.
But you can go to your GP, and if you had symptoms that were worrying you, or if there's a strong family history of prostate cancer, then you can ask for a test. But more often than not, the doctor will check your rectum area and check your prostate to see if they can feel anything craggy or anything untoward there, and they'll probably ask you to do a urinary test, a wee test, so we can make sure there's no infection. That's what normally happens.
Okay, so that's what PSA test is.
So the PSA test itself is a blood test, and there are age-specific ranges of normal. So as you age, you're expected as a man to develop some benign prostatic hyperplasia. We know that the prostate, so if you were in your late 80s, 90s, you're more likely to have developed prostate cancer by then. So it's a slow change, but if prostate cancer is detected, that's usually done by a biopsy, then they can intervene and tackle that.
Okay, that's really cool. In terms of when we talk about cancers, we always talk about the tips to reduce the risks of cancer. Now I know we still have like 6-7 minutes to end our show. I normally ask people to end the show on the tips of reducing cancers. So, do you have a top 10 tips or top 5 tips of cancer?
I do have top 10. So my top 10 of reducing your risk of cancer goes something like this. You give me 1 second.
No problem.
So, like I mentioned before, stopping smoking. That's the first thing I would encourage people to do. So if you are wanting to give up smoking, then I think that the evidence says that you're more likely to give up with support. So there are free stop smoking services, and they are shown to roughly triple the likelihood of success compared to going turking on your own. So those services help thousands of people to stop smoking every year. You can talk to your doctor or your pharmacist, or visit the NHS smoke-free website, or call the helpline to find out what will work for you. And there's many things to support you to try and stop smoking, to prevent your risk of cancer. And the range of free services to help you keep on track, including stopping smoking groups or one-to-one counselling, where a trained advisor can talk to you about your smoking habits, to give you tailored advice and support that will work for you. There's prescription medicine to help control your cravings. This can be nicotine replacement therapy or non-nicotine smoking medications such as Champix. And there are email and text support programs, and there's app for smartphones, and there's also the smoke-free online community as well. So that I would say that's my number one thing to do. If you're a smoker, please try and cut down and get help to support you to try and quit. They say that if you have a partner who smokes as well, you need to make a pact together to try and stop smoking together, because if someone carries on smoking in your household, it's very tempting. So you need to say, yes, we're both going to stop together. We're going to get rid of all the ashtrays, all the lighters, all the paraphernalia that goes with smoking. We're going to get rid of it. We're going to set this date, and we're going to try our best. And you need to tell your friends as well, so that they don't offer you a fag, and so that they are supportive of your determination to try and stop smoking. So, yeah.
Wow, okay. That's your number one.
Yeah, definitely my number one.
Okay, what's your number 2?
Number 2 is keeping a healthy weight. So obesity has been found to be the second biggest cause of cancer. Fat is active. They're active cells, and they tell other cells what to do. If there's too much body fat, then the signals can send around the body can damage the healthy cells. So being overweight increases the risk of 13 different types of cancer. So enjoying a healthy, balanced diet and enjoying exercise on a regular basis. And I know people struggle in their lives to fit in daily exercise, but it can be done just through walking or taking a flight of stairs, just to try and make your overall health better for you. Not only does that health benefits to reduce your weight and to reduce your risk of cancer, but it also helps your lungs and heart as well going forward.
Yeah, okay. And number 3?
Number 3 is enjoy the sun safely, because obviously in England we're increasing our risk of developing skin cancers. So being safe in the sun and reducing that risk of skin cancer, especially when the sun is strong, important to protect your skin and spend time in the shade, cover up with light reflective clothing like whites and creams, and then use sunscreen. And then sunburn is a sign that your skin has already been damaged. So it's preventing sunburn. That's what we're trying to aim for there.
Next one.
Number 4 is reduce your alcohol intake.
Definitely.
So drinking less alcohol reduces your risk of cancer. It doesn't matter what type of alcohol it is, it can still lead to damage. So cutting down on alcohol is both good for your health, and I think that's sometimes an easy thing to do. So we've all heard of dry January. We've just gone through that, and the government recommendation limits for alcohol are 14 units a week.
And that's one of the reasons it's not allowed in Islam to drink.
Okay.
But there are some people still drink, unfortunately.
Yeah. So, I understand it's a choice and people like to use it to relax. And I understand all that. And some people think it's a reward at the end of a hard day of work. But everything in moderation. So just to be mindful of that.
Okay. And fifth?
I'd say engage with our vaccination programs, like the HPV vaccination program to reduce the risk of cervical cancer. And then to engage in the national screening programs if they're offered to you.
Indeed.
Yeah.
I have a couple of stats, survival stats in front of me. So I thought it's a stats given by Cancer Research UK on their website, and it says the survival rate, percentage rate in cervical cancer is 63%, and this is the cervical rate says in from 2010-11 in England.
Okay.
The prostate is 84%, and bowel is 57%, and breast is 78%.
Okay.
Survival rate.
Good.
So I must say, it seems like the screening does help to increase the survival rate.
And I think going forward we will see more cancer survivorship.
Okay. As we just have in our last seconds, can you give a quick positive message for our listeners?
So you just need to look after your health. And if you're concerned or find any new lump or symptoms that you're worried about, please have the courage to go and ask for help. We'll be dealt with in a sympathetic fashion, and we will try and allay your fears. And if there is something that needs further investigation, we can organise those tests for you. And if necessary, we can refer you to get expert secondary care help as well.
Indeed. And thank you so much, Saheli, for joining us today and enlightening us with the utmost best information we can get online on the radio as well. And thank you so much for coming to our show tonight.
No problem, my pleasure.
And definitely we will be seeing you again shortly.
Thank you so much.
So this is all for our show tonight. Thank you so much. If you have missed any part of the show tonight, don't worry. We do a repeat on Sunday at 9 p.m. I think. So tune back Inspire FM at 9 p.m. on Sunday to listen to our repeat. You can always catch us on our Facebook page. The show is still away on there. Until next week, we have another show on next week. I'm your host, Fahad Matin, saying Assalamu Alaikum.
Thank you for listening to our podcast. We stream our daily broadcast on inspirefm.org. You'll find all our daily updates on our social media at Inspire FM Luton.